Most runners are told their form is natural and unchangeable, but biofeedback research proves you can reduce impact forces by 20% in just 6 weeks. The common wisdom that you run how you run is anatomically false. While your skeletal structure is fixed, your neuromuscular firing patterns are highly plastic. This is gait retraining, distinct from simply trying to run pretty. However, conscious cueing, thinking about your knees or feet, often fails. The brain struggles to manually control complex motor patterns. Studies show that internal focus actually decreases running economy compared to external biofeedback. Agresta et al., 2015, identified vertical average loading rate, VALR, as the critical metric to change. This is the speed at which impact force travels up your leg. High VALR is the primary predictor for tibial stress fractures. Real-time biofeedback works where thinking fails. By using visual or auditory cues triggered by force sensors, we bypass the conscious brain, forcing the nervous system to auto-correct impact forces in milliseconds. Bruneau, 2025, confirms this efficacy specifically for patellofemoral pain. Retraining isn't about aesthetics. It's a clinical tool to offload sensitized tissue by altering how load is distributed across the joint. The mechanism is a closed loop. The sensor detects a high impact, an audio cue beeps, and your body instinctively softens the landing to stop the noise. Over thousands of steps, this rewires the motor cortex. One of the most effective changes is reducing vertical oscillation, how high you bounce. Reducing this by just a few centimeters often naturally corrects overstriding and lowers impact forces without complex instructions. But does it stick? The data is promising. Studies show that after an 8-session fading feedback protocol, runners maintain these lower loading rates 1 month later, even after the feedback cues are removed. There is a cost. Your body is optimized for your current inefficient habits. Expect running economy, the oxygen cost of running, to temporarily worsen during the retraining phase before efficiency recovers. To change your form, stop guessing. Use a device that measures ground contact time or vertical oscillation. If you don't have data, you cannot retrain the nervous system accurately. Focus on increasing cadence to lower oscillation. Data beats intuition. Measure your impact, save your knees.